here with us now, Democratic representative from New York and member of the House Energy, Commerce, Health Subcommittee, Congressman Anthony Weiner. Congratulations over the weekend. Exciting news about health care reform. Yeah. What were the sticking points for you with the bill, if any, as we look forward to see if the Senate will get something through?
Well, I would have liked to see a completely different approach. You know, you and I have talked about this before. I think that we're doing this bank shut thing, a single-payer plan like Medicare, expanded to more Americans. But, you know, considering what we were up against, this is a pretty remarkable achievement. I mean, we had to do three things. One is make sure those that don't have insurance get it, so we're just not paying for them when they go into emergency rooms. The second thing is for people that have insurance, make sure they're treated well by their insurance companies. The third thing, the cost containment side, is that's what the public option fight is going to be all about. Yeah. And I think we did, on all three counts, we have a pretty good bill. It's not perfect, and there are some things in there that are problematic. But we're now basically in our red zone offense here, and we're getting very close to the end.
You know, Rich Amando talked about the Stupak Amendment, the abortion restriction language being a poison pill. You now got Lieberman saying, ain't going to have a public option in my Senate. Chances are good by the end the president signs a bill. It's going to be something. It's going to really be galling to you, a lot of progressives. There are going to be portions of it, but that's just, I mean, that's part of the process, isn't it?
It is. I mean, it gets tougher as it gets closer to the end. You know, Senator McCaskill had something very important wrong, that this is a dramatic expansion. This isn't just saying that no federal funds would go for abortion. This says that no plan that's sold in the exchange is going to be able to even offer those services. So it's going to be a strange dynamic. If you're an individual citizen, you're going to have to go out and buy a reproductive freedom, a rider for an insurance policy, and no one ever does that. No one expects to have that.
It's
going to be a real problem.
Let's strip this down, though. We've been trying to do it for a couple of hours. Help us out here. So if I'm a woman and I want to go into this public plan, I know that if I go into that plan, I will not get an abortion paid for, that I will have to do that on my own on the side, right?
Right, and there'll be no coverage for those people. Essentially, we're saying for the people that are uninsured or don't have insurance or are lower income people, you're not going to be able to have that coverage. And here's what's going to happen. The fear is health insurance companies are not going to have 17 different plans that they offer for different sectors of the economy. So they're going to make, as a default, we're just not going to cover these things to not run afoul of the new federal restriction. Right. And if you think about it, no, it's for unplanned pregnancies. No one plans on getting an abortion. So women are basically going to be left without that protection.
But certainly on the other side, though, and this is what the Hyde Amendment went to, that restricted federal dollars for abortions directly. But you certainly understand on the other side, like, for instance, the Catholic bishops, who said, we don't want to support a bill that would use taxpayer dollars directly or indirectly to fund abortions. I mean, you understand the other side.
No, but this is not, you see, this is an expansion beyond taxpayer dollars. We were prepared, and I'm not crazy about the Hyde Amendment, but to keep it in there. Right. This says that nothing sold in the exchange, even if a woman wants to use her own, even if someone wants to use their own money, they would not be able to purchase a policy in that exchange.
In that exchange, but they can go outside of that exchange. Well, they can go to a private insurer and get an abortion.
Yes, but here's who's going to be in the exchange. The exchange, all insurance plans are going to want to be in that exchange because they're going to want to take advantage of this 35 million or so additional customers. So the idea is going to be, if every insurance company is coming into this exchange to take advantage of this new pool, they're simply not going to offer that to not run afoul of this. It was unnecessary, and it's divisive, and here's what else it was. It didn't reflect the majority of the country or even the majority, frankly, I think, of the certainly not the majority of the Democratic Party, and that's the problem with
it. Got 240 votes. Why?
Because
basically, if it didn't reflect the majority, why did 240 vote for it?
It reflects, frankly, the overwhelming majority of the minority party. You know, what we essentially did here, what Congressman Stupak, who's a friend of mine, basically did, says, let's give control of the Republican Party to this particular vote, and that's why it became problematic.
Do you believe, like a lot of progressives believe, that Joe Lieberman is now going to try to block a public option in the Senate because he's bought and paid for by insurance interests in Connecticut? Or could it just be that he actually believes
here's what I'll say.
That a public option's the wrong way to go?
Here's what I'll say. It is inconsistent with common sense to say I oppose something that is going to hold down costs for the taxpayers and hold down costs for residents of Connecticut. So, I mean, look, the insurance industry is a powerful force in Washington, and so is the status quo. But the audacity of saying, and I think that he's backed away from this some, I'm not even going to permit a vote on the concept. I mean, let's let a majority of the Senate decide this issue. I think it's a tough issue. For me, it's a ground ball. To me, it's an easy issue. If you want choice, if you want competition, you introduce this additional choice, and the CBO says it reduces costs a great deal.
You know, I know Joe Lieberman, and I've made some comments about this as well, similar to yours.
Unfair comments. Highly unfair comments.
And I've been in touch with his office.
I'm sorry, go ahead.
Yeah. And it's nice of you to surmise what his motivations may be. It's very nice of you to surmise and for you to surmise. But we've invited him to be on the show, and they've said that he might. I think he should. I really think he should come and talk about exactly what's going through his head and what is motivating him on the decisions that he's making pertaining to health care reform. Also, we're not done with you, because we'll see you tonight at our health care town hall.
It's going to be a battle.
Yeah, well, listen, why don't you look, if you want to bring Lieberman here, and I think I can talk him into it.
Yeah?
You know what? We're trying to get him on here, Congressman.
Yeah,
if you could just stay out of it, that would really help us.
All right, we'll see you tonight at Joe and Mika's Healthcare Town Hall. Monday night, that's tonight, from 6 to 8 p.m. at 92Y Tribeca, 200 Hudson Street in Manhattan. That is tonight at 6.
Yeah, and we also have Money Party there. Dylan Radigan, he said he's bringing his crack pipe. Dr. Nancy's going to be there. You know Lieberman, right?
Yes.
I know him well. I know him and his wife.
Well, he doesn't like you because you're not telling the truth about him on TV.
He likes me. I've been talking to him.
Maybe you can call Joe. Will you do that for that for us?
Joe's basically a good guy. He goes off the trolley track sometimes.
He's a good guy.
You get the two of these guys together on the set. You say you can talk him into, coming back to the bright side.
It'll be like Yidlock here at Morning Joe.
Yeah.